Right, so we move on to the second session this morning, which is to hear what's in the fantastic report, which is on your chair. Please take them home with you because they're very heavy and we don't want to take them home ourselves. um, been running the Global State of Harm Reduction project since 2018, when we had funding from what was then the Foundation for a Smoke-Free World to do a couple of major projects, which are all about trying to get acceptance for tobacco harm reduction and to move to a world where safer nicotine products are available and accessible and affordable to everybody who would like to use them. Um, we've got, in fact, got two flagship projects. One is our Tobacco Harm Reduction Scholarship Program, and you'll hear a little bit more about that this afternoon. But the idea of that project was to increase capacity in tobacco harm reduction to get, given where we were starting, so 2015, 2018, there are quite a lot of emerging tobacco harm reduction advocates who are of a certain age, but we wanted to try to get new people into the field and start ideas of career progression and work within THR. And so we came up with the idea of the Tobacco Harm Reduction Scholarship Program, which has been running now since 2018. And we've had a total of nearly 150 people go through the first stage of that program. There are different levels of scholarships from 45 countries, and nearly 80% of them from LMIC. So it's been hugely successful, and many of the scholars have gone on to become THR leaders. The other bit of work is the major project on the global state of tobacco harm reduction, which aims to map progress with the adoption of safer nicotine products, map changes in regulation, and that in turn comprises some sub-projects. We have a major global database on tobacco harm reduction, on smoking, and on safer nicotine products, both prevalence of use and also on regulation across 200 countries and territories. And that KEC, you see a few people from KEC presenting today, but KEC is a large number of people working on a large number of projects, contributing to all the things we do. And that website, the country level website, used by all sorts of people, but we get around 25,000 visitors a month from around 200 countries and territories. We also have quite a lot of different publications. We have a series of briefing papers, which are for people who don't have as much time as you will have for reading the big report. These are kind of 2,000 words, straight to the point, coverage of different THR issues. And like all of our work, we make a big point of having our work translated into other languages, and we're the only global organization which is providing THR materials in 13 languages, which covers about 80% of the global literate population. When we started that, we weren't sure whether there'd be uptake in Swahili or Hindi, but the coverage and the readership is really good. So our publications, including all the reports we do, we've had about 350,000 views online for all our work over the last 4 years. So the big biennial report, which you have on your seats, which we launched today, this is our fourth report, and that tracks uptake of safer nicotine products. Many themes within this report, but one of them is how far safer nicotine products are substituting for combustibles. So it also looks at what might be facilitating that and what might be standing in the way. So it looks at development of regulations, including taxes. The good news is that the last decade has seen a major increase in the uptake of safer nicotine products, and in some countries associated with very dramatic declines in cigarette sales and in smoking. So clearly tobacco harm reduction works where it's given the opportunity to work. But the bad news is, and this won't be news to you, is that the last decade has also seen the rise of an anti-nicotine movement, of moral panics, regulatory failure in some countries, poor science, and misinformation. So I think one of the messages that you'll hear this morning is that much has been achieved, but so much more could be achieved if the obstacles were removed and if the environment was more positive towards tobacco harm reduction. The report is a major effort across the whole of KAC, and we've all shared the pain in getting it across the line. It takes an enormous amount of work to produce this, and there are a lot of people who've worked within the team to produce this. Today we've got three leading contributors. There should be a slide, actually. Can you put the slides on? Right. So we've got three of the leading contributors. Harry will explain the background to the report. Tom will talk about indicators of substitution effects, and Georgi will talk about regulation and tax, and then back to Harry, who will talk through the key takeaways. And as this morning, they'll talk consecutively, and we'll leave all the questions and comments to the end. So Harry, if you'd like to start us off, and I'll move the microphone to where you...
Thank you. As Gerry indicated, this report is what it says on the tin. It's a situation report which looks at where we're actually at in terms of progress. Two main kind of themes running through it, really. One is to actually chart the degree to which safer nicotine products have been taken up by adult smokers across the world. And I think, and we do a heck of a lot of data analysis to try and work that one out. Hey, there you go. Which is the point that Gerry made. So we collated a heck of a lot of data to try and look at all the different aspects of this. But I think also that there is an overarching theme also running through it of paradoxes, conflicts, and contrasts. Because as I'm sure many people in this room will be aware, it is not a straightforward issue. It's complicated. There's a lot of push me, pull you all the way through the policy landscape. So this is basically a hop, step, and a jump through what we've done. Chapter 1, in all our reports, we have to start with what the situation is that we're trying to deal with. I need to be closer to the mic. And the role that tobacco harm reduction can play in ameliorating the death and disease from smoking. Then we rehearse the evidence for tobacco harm reduction and also look at some of the factors that try to undermine that evidence. So a lot of the mythology around the evidence. But also emphasizing the fact that the credible independent evidence is that safer nicotine products help people move away from smoking and are actually also more effective than things like nicotine replacement therapy. Then we actually look at the data on what the progress has been, and that's something my colleague Tom will come to after me. Then moving on to sort of global regulation and control and the degree to which that, in many respects, is acting as a bulwark against further progress towards people switching to safer nicotine products, not least the efforts from the WHO in that respect. And then chapter 5 are the challenges. So global regulation and control is very much a challenge to progress, but there are other sorts of challenges as well, which I'll come back to when we get to the conclusions. I'll come back to what some of those are. Then the last section, which is separate items in your folder. We looked at a couple of regions that don't really get any publicity at all. I mean, most of the public narrative around this subject is Europe, is North America, Australia, New Zealand, those kinds of places. But these large blocks of territory, the whole continent of Latin America and the huge regions of parts of Eastern Europe and Central Asia really don't get any mention at all. And then finally, we select 4 countries where there is relative proportionality around tobacco, around safer nicotine product control, and relative is always a an important word in this respect, because there's no perfect regime around this, but these countries have demonstrated what is possible in relationship to some proportionate and pragmatic response to safer nicotine product control. And I'm going to leave it there, and I'm going to pass over to my colleague Tom to take you through what we know about global progress in tobacco harm reduction and the data that surrounds it.